We're back with Dr. Crapo in his office, and I'm going to talk about implants, and I think I might have the wrong impression of exactly what we are going to talk about, because there are all kinds of different implant situations available for patients these days, I gather.
There are lots of implants, all the way from replacing a single tooth to fixing one's denture, or even a partial denture, or making you over as if everything had grown that way in the first place.
Well, yeah, I was looking at well, you have some teeth here,
Yeah.
and it's like sort of an amalgam between dentures and implants.
Right, we can take a person's denture and convert it into a bridge in one appointment. And they go away.
In one appointment?
In one appointment.
How do you do that? I don't get it.
Well, it's a matter of getting the implants in place and then taking their denture and fitting it to the implants and making sure that the bite is right and they leave. It's about a 4-hour procedure, all in all, and that's where our sedation dentistry comes in. And very quick.
You wouldn't want to be awake through all this, I suspect.
Yeah, it's nice to be someplace else.
And then you have something else here that's totally different.
Yeah, this is a situation where implants now become the foundation of actually a bar, and the bar has attachments that allow a person to fit their denture over and keep it nice and snug. And this is really important for lower dentures, for instance.
So they just snap in there.
They just snap in like a button on a Western shirt. Yeah.
Like a button on a Western shirt. I'm sure there's way more to it than that.
There is, but...
How would you know if you need an implant? I mean, I guess if all your teeth fall out, that'd be a sign, but...
Well, yeah, but usually we catch it way before that time. I mean, in the past, people have replaced spaces when they've lost, say, a 6-year molar. So you're 35 years old, and the tooth that came in when you're 6 years of age went bad, couldn't get it restored any other way. It came out, you had to put something in there. So it was either a bridge or a partial denture historically. Now we can place a metal root in that spot.
And then you do this with titanium, I understand.
Titanium, yeah. It's a titanium.
It's pretty space-age stuff, isn't it?
Yeah, it is. It's great. And the body seems to really like titanium, especially the oxide that forms on the outside of the implant.
Yeah.
Yeah.
Now this would be an option for people who can't have a cap put on. I mean,
well, like for instance here, the person has lost the tooth, and what are we going to do? Are we going to cut down those good teeth? No, now we can place an implant right into the bone. There you can see it in the x-ray, and one of these implants then will go into place, and it sits right beside the roots of the other teeth, anchoring the new tooth in place, and so it looks quite lifelike.
You know, the thing I'm quite taken by is you make it all sound terribly easy. Now, I know it isn't. You went to school for this. But, I mean, all of these things can be done now, and I guess it's just a matter of the people coming in to ask about it and finding out more.
Yeah, it really is. And once you're trained and you take all the precautionary steps, it does turn out to be rather a simple, straightforward process.
Dr. Crapo, thank you very much for this.
Thank you.